Happy Friday. So today I'm going to be discussing the 5 things that I would never do as a plastic surgeon. So I'm going to first list them off and then I'll go into more detail. So number 1, I would never do a thread lift. Number 2, Kybella. Number 3, Coolsculpting. Number 4, butt implants. And number 5, above knee lipo. So why would I not do a thread lift? So thread lifts are kind of like the go-between like you kind of need a facelift, but you're not really at this stage where you want to accept that yet, or you need a little bit more than filler. Filler just kind of plumps the face, but you might have some extra skin that either needs to be removed or kind of lifted. So thread lifts are kind of like a go-between where, patients don't really want to make that committal step to a facelift, but they might need that and benefit more from that than a thread lift. Thread lift, the actual stitches that are used for the thread lift, they can extrude, meaning they can come out, they can get infected, it can be painful, and then also it's temporary. The results last about 6 to 9 months, and then you have to get it repeated. And then when you eventually do need a facelift, then your surgeon has a lot more scar tissue to deal with and a much more difficult operating field. Number 2, Kybella. So in theory, it sounds great. You're injecting a substance into the fat that's going to melt away the fat, if you will, but it takes multiple sessions. You look like a bullfrog for the majority of the time because it causes intense inflammation and swelling, and it's also a very painful injection. So I think you should rather just go straight to liposuction or a neck lift if you want to get any Kybella underneath your chin. Third would be Coolsculpting. So Coolsculpting, again, sounds pretty cool in theory, freeze away your fat cells, but one of the complications of Coolsculpting that the model Linda Evangelista has been very open about is paradoxical adipose hyperplasia. So basically your fat cells can hypertrophy or get larger when you do the Coolsculpting, which can disfigure you, and then you need surgery to correct that, which is either direct excision of the fat or liposuction. But again, you're creating a lot of scar tissue. And Coolsculpting might work for like little stubborn areas of fat, but overall, I just think that you'll get you get a better result with a surgical tool such as liposuction or like a tummy tuck. Fourth, butt implants. Butt implants are so problematic. I've only seen patients to have them removed because I don't place them. All this stuff I'm talking about, I actually don't even offer to my patients because I only offer things to my patients that I myself would get or that I believe in. So butt implants, I think they're just fraught with problems. So most of the time patients just find them very uncomfortable, unlike breast implants that a lot of patients just kind of get used to and it feels like a part of their body almost. Butt implants, you're sitting on them, they can get easily kind of malpositioned. You can get an infection. There can be just pain associated with them and discomfort. So butt implants are just such a bad idea. So many reasons. So I usually counsel my patients that fat transfer to the buttocks, like a BBL, Brazilian butt lift, is much better than getting any type of implants placed in your butt. And as a side note, as like a, what else I would never, ever do is silicone injections to the butt, which is illegal. But some patients will go out of the country to get them done or get them done at sketchy places in the US. So that is horrible. You get silicone granulomas, and you don't want to be injecting straight up silicone anywhere in your face or in your body. Okay, sorry, I digress. So, and then number 5 would be above knee lipo. So I'm not talking about like inner knee lipo because I do inner knee lipo. I'm talking about right above the knee because here over our joints, we need to move our joints. And so we have extra skin over them. So the skin's not super tight over our joints. It's not supposed to be. So when you have a little stubborn fat pocket or whatnot above the knee, if you do lipo there, the skin doesn't contract down as well as it would maybe in some other areas of the body. So increased risk for contour abnormalities and loose skin, and overall just not a good idea. All right, well, I hope that helped cleared some questions you might have and also give you some insight as to what I as a plastic surgeon would never have done. So hopefully that helps, and I'll see you next week.